Welcome, everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 46 new cases of COVID-19 in Windsor and Essex County. 19 are close contacts of confirmed cases, 9 are community-acquired, 2 are outbreak-related, and 16 cases are still being investigated. We have had 15,911 cases since the beginning of the pandemic. 330 people are active at this time, with 171 of our active cases having a variant of concern. To date, 1,242 preliminary or confirmed variants of concern have been identified in Windsor-Essex County. 92% of these cases have been identified with having the UK variant. 3 cases have the South African variant and 4 the Brazilian variant. 19 people are currently in the hospital and 3 people are in ICU. Our community has lost 419 people to COVID-19. There are currently 5 active outbreaks in Windsor and Essex County, 4 in workplaces and 1 in the community. Now for our vaccine update. 199,767 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 185,277 people have received at least 1 dose. Overall, 54.4% of adults 18 years of age and older in Windsor-Essex County have received at least 1 dose. We have Today, we are announcing that people 30 years of age can now book their COVID-19 vaccine appointment at one of our vaccine clinics. In addition, essential workers from the second group are now eligible to book. These essential workers include retail workers, including grocery store workers and restaurant workers, workers in manufacturing supporting the COVID response, construction, social service staff, courts and justice system workers, transportation, warehousing and distribution workers, truck drivers, marine and rail maintenance, those working in electricity system operations.
We begin tonight with the whip.
Communications, water and waste management workers, financial services, veterinarians, oil and petroleum workers, natural gas and propane gas workers, mine workers and uranium process workers. It's a very large group. Please check wevax.ca to access our booking system for the complete list of people now able to book. So to recap, residents 30 years and older are now able to book. Residents 18 years and older living in hotspot postal codes can book. N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. Those 18 years and older with highest, high, and at-risk medical conditions are now able to book. The first and second group of essential workers who cannot work from home. And in addition, those 18 years of age and older can sign up to be on a wait list and be called in short notice if there is the availability of an extra dose at a clinic. So please visit wevax.ca or call 226-773-2200 to book your appointment. I know it's a lot of information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. Yesterday, the province of Ontario, on the recommendation of the Chief Medical Officer of Health, has suspended all first doses of the Astrogenic COVID-19 vaccine. The decision was made out of an abundance of caution with cases of blood clots that was coming up in the province. More details will be shared in the coming week for those who are waiting for the second dose. I'll now switch gears to talk about another important event. This evening starts the celebration of Eid al-Fitr, a celebration for many residents in Windsor and Essex County. Eid al-Fitr is one of the most important times for those who celebrate. It marks the end of the holy month of Ramadan and usually is a time where Muslim families come together to pray and celebrate. While the fasting observed in the holy month of Ramadan has a deep spiritual significance, Eid celebration consolidates the lessons learned through fasting, praying, and learning more about their religion. Like all events this year, the celebration will be different. We must continue to follow public health guidance, celebrate safely to spread spread of COVID-19. This year, choose to pray at home with only those you live with or pray virtually. Limit your social gatherings with your household only and choose virtual options to connect with friends and families. People living alone may consider joining one other household of a close member or a friend. Focus on the positive and practice self-care. Find time to spend with your children and family and take some time away from the news and flood of information on COVID-19. Spend time outdoors, go for a walk or bike in your neighborhood. These recommendations still apply for individuals who have already received 1 or 2 doses of the COVID-19 vaccine. Remember that this is a time of generosity, reflection, and rejoicing. Keep yourself and everyone in your family and community safe by following public health guidance. Thank you.
We'll now take questions from the media, and we'll start with CBC Windsor.
Gotten the Astrogenic vaccine in this region. Are you concerned about vaccine hesitancy and confusion that this move from the province might spark?
Well, I think it is important to stay up to date with respect to what the scientific findings are. And like always, we take vaccine safety very seriously, locally as well as provincially and federally. Any indication of any adverse event which is of concern is reported and actions are taken immediately. By far, the vaccine has been pretty good locally. We haven't had we haven't heard anything, any reactions to the vaccine in our region, which is great. And again, it all depends on the risks and benefits. When the AstraZeneca vaccine arrived in our region, we were able to vaccinate a lot of people with a good vaccine that has shown some promising results from UK, and in UK, the predominant vaccine that they used is AstraZeneca. So it's all a matter of supply and all a matter of what the true risks are. Knowing that there are a steady supply of Pfizer and Moderna, and as a result of that, we are in a position to take some of these rare events seriously, and we're able to stop giving out the first doses of vaccine. And we'll, as more evidence will come up, we'll share additional information with everyone else.
Thank you. On yesterday's call, the sort of pop-up style clinics being offered by primary care providers was brought up. I'm wondering how many vaccine doses are going to these clinics, and is there any way that we can be looped in on what vaccination events are happening, or just wondering, I guess, a bit more about what's happening with these clinics.
So I'll share what I know. We give vaccine to the primary care providers. So based on the amount of vaccine that they're using for their regular clients, and as we open up age groups, the amount that they feel that they can actually use in their clinics and safely administer by within the requirements of distributing the vaccine. So every primary care will be a little bit different based on their client base and their ability to vaccinate their people. So the distribution or the method or the channel of how the clinics are doing their vaccines. Some are doing it just in their offices, and as you know, others have distributed it through other methods, such as the drive-through or inviting the public to come in a certain area. So we don't have. We support them and we give them information regarding the vaccine that they'll have availability to use. And like, for instance, last weekend, and I think I shared this, one of the clinics was given 300 doses and asked for another 100. So we're trying to support them the best we can. We don't know exactly what they're going to be able to use. It's all based on the response and how well they're doing that day. We are I know last week we did post something to our Facebook site. We don't often have everyone's plan in place, but we did provide a little bit of information. We're not leading these, we're supporting these. So we don't always have the exact information as you're, to list on our website or anything like that. But as the clinics are getting vaccine, they're trying to make sure they use it and thinking of strategies that work for them based on their resources. So they are using their own human resources. So I guess that's a very long way to say that we'll share what we can, but we don't often know every bit of information.
Thank you. Is there any word on whether WINDSOR's been approved to receive those Pfizer vaccines from Michigan? Also wondering if we were to receive that influx of vaccines, how much of a difference it would make in our local vaccination rollout.
Well, obviously, there are a number of channels that these talks are happening right now, and just even applying for that doesn't necessarily mean that we are getting the vaccine. It's one of the necessary steps, but there are other steps that need to happen before we get the vaccine, so that's number one. If we get the vaccine, obviously, we'll have plenty of vaccine to not only use for our region, but even with the to share that vaccine with our neighboring health units as well. So I think we'll wait to see how much of those vaccine that we can get, if at all, and then we'll work locally. Obviously, our priority will be to vaccinate our local residents as quickly as possible, and then based on the current structure, we should be able to administer the vaccine as quickly as we can.
Thanks very much.
Next, we have Blackbird News.
Yes, I have a couple questions from one of my colleagues. She's working on a project about rapid testing kits for workplaces. The province just made an announcement. Would you recommend that medium and small size businesses apply for these testing kits?
Well, I think it really depends on the risks of these businesses and how they are testing these individuals. I think the critical piece is we all have the same shared goal of identifying cases early on, and then to isolate and these cases to prevent any further spread. There are a lot of other systems that needs to be in place, not only just for the testing. And I think that's the critical piece that I want to make sure that everyone understands, that it's not just the testing that will take you to that level of comfort. You have to have a good system in place of screening, assessment, people staying home when they're not feeling well, or if they have any kind of symptoms, and with the workplaces having all these infection prevention and control measures in place. So it's just not a easy way to just have some of these things in place to test people and then just to rely on the testing piece. If the organization have the ability to do all of that, it does come with a requirement and responsibilities. And if they're able to do that, then yes, they should do it to make sure that we're all trying our best to keep everyone safe.
And on that note, you talk about the responsibility of once we have the results. According to the provincial release, if they get positive results, they don't have to be reported to the health unit. Does that concern you?
Well, that's where we need to be very clear in terms of how these test results are interpreted, recognizing that many of these test results are rapid test, and rapid test would have some concerns with the sensitivity and specificity of these rapid tests. And these needs to be validated using the PCR testing. So anytime these tests comes back positive, it needs to go for PCR testing, and then the final result will be reported to public health. But as I said, these are some of the challenges that we have to address before we can expect these businesses to start operating it. But with the guidance from the ministry, I think there will be further guidance, additional guidance will be coming, just to make sure that the system as a whole is working seamlessly without anyone falling through the cracks. As I said, there are other things that everyone needs to follow on top of these testing as well.
Good, thank you.
Windsor Star?
So, Dr. Ahmed, with today's announcement of the lowering of the eligibility to those 30 and older, and additionally the Group 2 essential workers being eligible, the large number of people who are now eligible, what factors in the recent days have led to this decision?
So we look at our coverage rates in each of these age groups, and we're also looking at how much vaccine that are coming to our region and what are the available delivery mechanism that we have in our region to distribute these vaccines. When we hear about steady supply of vaccine coming into our region, we feel much more comfortable to open up more age category. When we see that we have people when we see that there are possible appointments that we can open up for additional groups that will allow them to book the vaccine quickly, we do make that decision. But at the end of the day, as I've always stated, our goal is to vaccinate each and every one of our residents who want to get vaccine as soon as possible. So every opportunity we get, we try to open up more and more eligibility criteria to increase access and to get everyone vaccinated.
Is there any estimate as to how many more people are now eligible for the vaccination?
I don't have that number right in front of me, but that would be in excess of at least 20 to 30,000 people. But mind you, many of the Group 2 essential workers will also fit into the age bracket as well. So there may be some overlap, but that's just a rough estimate. I don't have the numbers right in front of me, but that's the typically the each of these age band represent that many people.
Are the resources in place to handle an influx of eligible vaccinations of that level?
I hope so. I think we have the online booking, which we always prefer for anyone who has the ability to go online and book directly. It gives them a little bit more flexibility. And with the call center support from our municipality and our hospital partners, we are able to provide service to those who do not have access to the internet or computer, and they should be able to book that. And we'll continue to reassess that if the demand exceeds, we'll try to fulfill any gaps if we find any gaps and challenges for people accessing the system.
Thank you.
AM 800?
I guess with the latest changes in the age in the Group 2, are the hours changing at the mass vaccination clinics as well, or are the hours staying the same?
So I'll start but basically the hours will stay the same because again the supply of the vaccine is limited from the number that we are using at the mass vaccination clinic, but we do have other channels that we are using, such as our primary care providers and our pharmacy, and combining all of these channels, we are able to use all of our vaccines. So even if we open up additional hours, that doesn't mean that we'll have the vaccines for that. And right now it's working fine because we're all using the same resources. There are a limited number of healthcare providers, limited number of resources that are available to run all of these clinics and to give out the vaccination. We are using all of these health system partners very efficiently and effectively to get the vaccine out as quickly as possible.
I just want to make sure things haven't changed. So basically, I think 2 of them are open 7 days a week, and then the rest are 5 days a week?
I'm looking at Teresa, and I think seems like about right. So Teresa?
Yes, that's correct. So right now, Windsor Hall and Sportsplex are 7 days a week, and the other three, WFCU in Windsor, Nature Farm Fresh in Leamington, and the Libro Center are in Amherstburg. They are 5 days a week.
Okay, thank you. And one final question, Doctor. Just in regards to AstraZeneca, I know you presented this, I believe, in the presentations on Friday. How many individuals in Windsor, Essex have received the AstraZeneca first dose vaccine?
I think we more than 30,000 doses that we have administered, and I'll try to send you that number later today. Rob, is that okay? If that's okay with you?
Yeah, that works. I guess if we use that 30,000 number, just maybe for this next question here, what's your message to those individuals? Kind of going off CBC's question, but should they be worried, concerned? I guess what's your message to those 30,000 rough estimate, like you said, individuals?
No, I think they made the right choice by getting the first vaccine available to them. And like any other vaccine, like we're talking about vaccine, but let's just talk even about some of the medication that we use. And there are different levels of risk associated with each of the medication that we use. But and sometimes these risks are much higher than what we are seeing with AstraZeneca or some of the other vaccines that we are talking about. So I think it's the right move. And when you have that high number of cases in the community, you definitely want to protect yourself by getting the first dose that's available to you. And right now, I think we will continue to look at the evidence. We'll continue to find the best way to vaccinate our residents that is safe and that is effective to prevent any complications associated with COVID. And we'll continue to share that details with them. But as I said, even Teresa, she got AstraZeneca and she's fine with the decision. I think it's just a matter of timing and access and availability of the vaccine. So when we have more information about the second doses, we will share that information. And Teresa just pointed out that we have provided 37,071 doses of AstraZeneca vaccine in our region.
Thank you.
CTV?
Yes, good morning. Does the pause on AstraZeneca slow down the local rollout at all?
I don't think so, because we already were not getting much of AstraZeneca. We are seeing more and more of Moderna and Pfizer vaccine in our region. So we'll continue to use those vaccines. And based on the projection, we are only seeing at this time Pfizer and Moderna. We are still waiting for additional information on Janssen vaccine. It is allocated to WINDSOR ESSEX region, but we don't know when it will arrive. So we're just waiting for that. But right now, it's just Pfizer and Moderna vaccine that we are using and we're getting.
Will Johnson & Johnson want to be allocated towards a specific population?
It is because it's a one-dose vaccine, and the best way to use that in a group that is difficult to reach or with concerns about them coming back for the second doses. So that's where these vaccines are indicated for. For example, people living in the like a homeless population, people living in the correction settings and other places where you only have the opportunity to give them one dose of vaccine. So hoping that when it's available, we can offer these vaccines to the group that are mostly difficult to reach and track down for second doses, so it will work out for them. But our goal is to vaccinate everyone as quickly as possible with the available vaccine, and we'll continue to work on that.
And what do pharmacies do with any AstraZeneca doses that they have remaining?
So there are guidance that they have to, first of all, separate it out with the rest of the vaccine, and they will be provided with additional instructions on how to send those vaccines back or to store them until before they. So the idea is for them not to use the vaccine, and they will be given a specific guidance whether to send it back or to keep it secure until they are told to send it back.
And just wondering, what are your thoughts on the reopening of more outdoor spaces like the Ontario Science Table advises?
So we know that COVID-19 spreads more in an indoor setting, and with the weather improving in Ontario, there is definitely the opportunity for people to spend more time outdoors. And the only question is how you can do it safely and without causing any other challenges, because we do know that, when more and more people are out in a small area or in a setting, it just makes it more challenging for people to maintain physical distancing and whatnot. So I think it's just finding that right balance of ensuring that people can enjoy the outdoor spaces, but also doing it safely. That's the challenge, and where the fine balance will come, we don't know at this time.
Okay, thank you.
Any additional questions from CBC?
Yes, a totally non-COVID related question. Has the health unit started larviciding for mosquitoes this year? I'm wondering what those efforts entail, where it will be taking place, and if you could get into the risks of West Nile.
Great question, and thanks for a change in the question and not talking about COVID and vaccine. Yes, so West Nile virus, we do have our mosquito control program, and we do have a surveillance strategy that is in place with the larviciding opportunity that I believe it's already started. And we work with a third-party vendor to do that larviciding for us, and while our health unit team are doing the surveillance. So we know that West Nile virus is almost, we see cases every year with positive mosquito pools. So it's a great reminder for people when they are enjoying the outdoors to be mindful of these mosquitoes and how to protect themselves from getting bitten by the mosquitoes. And on the same note, it's also, we know that people need to be careful about the ticks when they're going out in the spring and enjoying the outdoors. So it's just making sure that people are taking all the precautions when they are out and about. There are guidance on our website for both ticks, Lyme disease, and West Nile virus. Please visit our website for additional information and ensuring that you are keeping yourself safe when you're enjoying the outdoors.
Thanks very much.
Additional questions from Blackburn?
No, thank you.
Windsor Star?
Just to revisit Rob's question regarding the AstraZeneca, what words of comfort or relief can you give to those who have received their first dose of AstraZeneca and are worried about supply for the second dose?
Well, I think they shouldn't be worried about the second doses at all. I think we'll provide them with the best available scientific advice. As I said, right now it is for people who have received the first doses and didn't experience any symptoms. It would be unlikely that they will get any reaction from the second doses if we move in that direction. But we also know that there are a number of studies that's been happening to mix and match some of these vaccines, and so that direction may come as well. So before anyone is eligible for the second doses, we'll have very clear guidance. We'll have clear options for people to receive either the second dose of the same vaccine or second dose of a different vaccine to ensure that they are protected from COVID.
I know that study is still in the waiting, but do you have any estimate as to when there will be guidance on the possibility of mixing doses?
So I know that the National Advisory Committee on Immunization are expected to provide guidance before the end of this month. I don't have a set date in my mind, but and maybe that their recommendation may come before the actual findings are released from some of these studies. But going back to the vaccine science, it's not completely unusual for people to mix some of these vaccines, because at the end of the day, the vaccines are triggering the immune system to generate that immune response that the body needs to fight off the virus. And so in theory, there shouldn't be any concerns by mixing those vaccines. But we want to make sure that it is scientifically, as much as possible, it's backed by science, and there are good reviews done to ensure that which vaccine can be mixed with which type of vaccine, whether the mRNA would just stick to with the mRNA, and then the non-mRNA, such as the viral vector vaccine, should be sticking with viral vector vaccines, or mRNA with the viral vector vaccine. So there are all these combinations that they need to figure out before they make any final recommendations. But rest assured, I think it's possible, and we will be providing the best evidence based on the best available scientific data, and keep everyone safe and protected by getting the vaccine.
I know this is a very speculative question at this point, but I read that there's a possibility that combining the mRNA vaccines with the viral vector vaccines could actually lead to even better protection. How does that work?
So I can't comment on that part because I think we'll have to wait for some of the scientific data to arise. But as I said, it just different ways that the vaccine triggers the immune system. The mRNA-based vector vaccines, it triggers the messenger RNA in a cell to create the spike protein that the body then identifies and then develops an immune response to that. While the viral vector vaccine, they use these viral vectors to get the proteins inside the body, that then the body identifies those protein and then prepare the antibodies in response of that. So those are two different mechanisms, and at this time I can't really comment that combining these two, whether it would result in better effectiveness or lesser effectiveness, I don't know, but definitely it will help to ensure that the people are vaccinated, people are protected, and the body develops the immune response that it needs to fight off the virus in the system.